Have you ever wondered what does those medical words mean when they are said by a healthcare professional around you or from a medical web series you have been watching lately? And what exactly the person is trying to express by using such terminologies or words? Have you? So my name is Mohammed Faheem and I am a third year MBBS student from Hyderabad, India. And today I am going to explain a brief overview of medical terminologies. So before I begin, I would request you to please consider watching this video till the end, and I promise it will be worth your while. So without further ado, let's begin. The entire video is divided into three parts actually. The first one being medical terms, the second one being medical prefixes and suffixes, and the last one medical root words. Starting with medical terms. Before elaborating some of the medical terms, let us first understand that these terms are universal and they mean exactly the same wherever they are used. So let's begin. So the first one is acute. I think this is the most widely used term. It signifies a condition that begins abruptly, but the duration is short and is sometimes severe. For example, if I am telling acute, it means a condition has a short course of progression, and most of the times the symptoms are somewhat severe in acute conditions. Chronic. It means that something which is persisting for a long time and it is constantly reoccurring. For example, heart diseases follow a chronic pattern of progression. Relapse. To fall back into illness after apparent phase of recovery or convalescence. Reinfection. A second infection that follows recovery from a previous infection by the same causative agent. Please note here the difference between relapse and recovery is that in relapse, the cause of the disease is still present but shows apparent signs of recovery. But in reinfection, the cause of the disease is reintroduced to produce the disease after complete elimination of the cause. Prognosis. It predicts outcome of a disease progression and treatment. Now you may ask, how do we know how a disease will progress and how can we predict it? But we can predict it beforehand. Here, the answer lies in the past experience of researchers and doctors. Diagnosis. It is knowing which condition or pathology is affecting our patient by examination. Or, in other words, it is a process of determining by examination the nature and circumstances of a disease condition or the decision reached from such an examination. Now, moving on to medical prefixes and suffixes. Dys. It means abnormal, difficult, or painful. For example, dysuria means painful urination. Dysphagia means difficulty in swallowing. Ectomy. Surgical removal of something. For example, appendicectomy means removal of appendix. Otomy. It means cutting into a part of the body. For example, gastrotomy would be cutting into stomach. Ostomy. It means an artificial opening into an organ of the body created during a surgical procedure. For example, tracheostomy means opening up the trachea. Plasty. It signifies surgical repair of something. For example, laryngoplasty means repair of larynx surgically. Osis. It indicates something is abnormal or a pathological process. Pathy. Disease or disease process. For example, retinopathy for disease process involving retina. Neuropathy for diseases of nerves. Itis. It means an infection is localized to a particular tissue or organ. Primary. First in order of principle. Secondary. Second or inferior in order of time, place, or importance. So now moving on to medical root words. They signify the involvement of the organ system involved in question. For example, gastro related to the stomach, cardio relating to the heart, encephalo relating to the brain, hemato pertaining to blood, pulmo relating to lungs. So now let me decode how does these terminologies are combined and how can we decipher from the name itself the condition or disease we are talking about. Let's take for example primary amoebic meningoencephalitis, which is a disease caused by a free-living amoeba called Naegleria fowleri. So it is divided into many parts. The first one being primary, which signifies the clinical stage of the disease. The second part, amoebic, signifies the nature of causative organism. And the third part, meningoencephalo, it signifies the root word, that is the organ or tissue involved. And last, itis, indicates suffix. And at last, itis, it indicates suffix, that is inflammation of the said tissue or organ. So like this, if we study the basic terminologies, then only we can get some idea about what the word is telling us and we can precisely tell what is going on only by the words itself. So that was a brief overview of basic medical terminologies and their interpretation in real life. And at last, my request is that if you like this video, then please subscribe to this channel and share this video as much as possible. And comment down below about what other topics you would want me to explain in the next video. Until then, keep learning and be curious.